Dr. Jaiganesh, consultant physician and diabetologist from Chennai. So, today we're going to talk about heart failure. It's practical points for the patients. What is heart failure and what they have to do to keep themselves, fit and healthy when they get this thing. So that's what I'm going to discuss today. Okay, so first of all, we must know what is heart failure to take care of it. First of all, heart failure is, as the name suggests, by itself. So failure of the heart to do its functions. Heart's function is nothing but to able to pump the blood forward so that to send the blood to all the organs, right? So when the heart are unable to fulfill the function, like unable to contract well, unable to relax well, so these two things, if it is not happening physiologically as per this described, then what happens? The heart failure ensues. Thereby, the blood circulation, blood supply to the vital organs gets affected. The patient may have low blood pressure, dizziness, breathlessness, and all. So this is in a short, way. It's not a definition, sort of, patient understanding. I would say this is what heart failure is. It's quite common nowadays because, as you know, heart failure comes to people with heart diseases already having, circulation deficit, like coronary heart disease, what we call, and also it comes to patients having childhood heart disease, like rheumatic heart disease and also congenital heart diseases. But majority nowadays it comes to coronary heart disease, and various other factors also. So nowadays, as the coronary heart disease, the CAD, what we call it, is increasing. What are the heart attacks? All this is increasing trend in India. So the prevalence, what we call the people suffering from heart failure, has increased over a decade. If you see for the past 10 years, it has increased very high, tremendously, and I would say roughly from 1 to 2% should be the prevalence of heart failure in the general population if you take, which is very big numbers, I would say. As I already said, heart failure, already known patients having heart diseases like coronary artery heart disease, which means we all know heart attacks or circulation deficits, so the blood doesn't go well into the myocardium. These sort of heart patients, heart disease patients, gradually due to the myocardium, what we call the heart muscle, dies out, and it is unable to function efficiently, to pump out the blood, and that is the more common cause of heart failure. And elderly, generally, elderly people are at risk. And diabetes and hypertension, people having diabetes, hypertension, even without heart disease also, they may not have any separate heart disease. Only due to diabetes, sometimes even thyroid diseases and hypertension, they can directly lead to heart failure. It's also quite common. So these are all a group of diseases. We should be very careful about these chronic diseases. Control each one of them, like sugar, hypertension, cholesterol levels, elevated cholesterol. All these should be addressed to prevent this heart failure. Okay, so you are talking about what the people have to do, what they have to understand, and how to manage them, right? So, a patient with heart failure, once they are diagnosed, you all know, first, of course, only the diagnosis done by cardiologist and physician. So, what they have to do immediately is they have to stick to the treatment plan. What are the medicines prescribed by their doctors? So, they should stick to the treatment plan. First thing. Second thing, they should not panic, because like any other organ, if it is failing, there are medicines to improve the functions. Nowadays, umpty number of medicines are there, even latest medicines such as sacubitril valsartan combinations, Even so many medicines are there. Even today's world, we can manage very well the heart failure with medications. But of course, medications alone is not enough. So we must understand that dietary management also very important. The patient must be very cautious about the diet they take. They should be taking very cautious amount of salt. Salt intake should be low, and water intake also will be prescribed by the concerned doctor. They should stick to the water intake also, so the salt and water, and then whatever the fat intake, the saturated fat, or these things also should be taken into account. And then the exercise. Again, exercise is a tricky thing. Your heart failure patient should not go do for a very hard exercise. Saying that they should not be idle also. So as per the level of heart failure, they should consult their doctors to gradually increase, step up the exercise plans. This is one thing. And then you all know other things, stress or something that are try to avoid the stressful situations. They should avoid strenuous exercise and condition. This should be avoided. But all this, as per the doctor's advice, they should follow, depending on their current position. But at the end of the day, they should not skip their medication. That is the key. This is what I think. Apart from medication, the patient, I told about the general measures what the patient should do, and any symptoms, any other, increasing of breathlessness or any, swollen legs, and breathlessness, they should, talk to their own doctors immediately and should not, delay management because it may be fatal. They have to be very cautious. That's one point. Well, correct. So new forms, many treatment have come. Conventionally, there were very limited medications for heart failure. Nowadays, apart from the diuretics, the water tablets, what we call, many other tablets come. As I already mentioned to you, so the newer medicines like sacubitril valsartan, one medicine is there, which is a combination of ARB and the sacubitril medicine. These two together, can really help the patients with heart failure. That's one medicine has come out newly, and many other group like that are there. So, there are definitely a number of a table of medicines I can tell you are there, which the patients should take the help of the doctor to really get on with the management. Yes, the message is this: the heart is very vital part. That is anything if you call, even for a city, if you call, heart of the city they call, where everything is happening, which is very vital, which holds the city, something like heart of the city, heart of the place, heart of the country, something like that. So heart, you all know it's the main thing, and you not say. So taking care of the heart is like taking care of your life. So take care of your heart, you live longer. So as much as your heart lives, you live. Simple. So a patient with heart failure, yes, they have some deficiencies, they have threat to the life, yes, accepted. But they should not just get carried away by these worries and difficulties. They should put the fear and worries, anxieties apart, and they should work hard to get back, the functions of heart to near normal as possible, and do some sort of lifestyle modification, to be able to keep the heart function as normal as possible. If at all with the medications, if it is not normal naturally with diet and other things, with medications, that you should keep try to use the medication. Of course. So that way I would see that's the message I would say to the our patients, should not lose their heart over this heart failure. Yeah, you can make your heart stronger by healthy lifestyles. First thing is healthy lifestyle. Second thing, a determined mind. You should be, whatever happens, you should be determined. And the third thing, to leave away the bad habits and all, which may affect the heart. All those smoking, alcoholism and all. Should cultivate the good habits. Should do regular exercises to keep yourself hot from getting faint, and of course spare some time for, apart from work, we are all busy working. Spare some time for your family, leisure and relaxations. By all these means, I would say, you can, all can keep the heart stronger. And a strong heart is, is essential for strong persons. The heart is strong, the person becomes strong. The person, people becoming strong, the nation. Yeah, thank you. Thank you.